Hello everyone! In this video, I am going to talk about Donepezil tablets. Donepezil is one of the medications that improves symptoms of dementia, and it is well known by its brand name, Aricept. Clinically, it is classified as an acetylcholine esterase inhibitor that improves cholinergic transmission in your brain. Dementia, or loss of memory, is one of the debilitating factors that impairs your daily activities. As age progresses, we generally observe a slight decrease in memory function. But in people with dementia of Alzheimer's type, a significant reduction in memory function can be observed. Alzheimer's disease is a progressive neuronal disorder that causes age-related loss of memory and is more frequently observed in the elderly with an age group greater than 65 years. Loss of memory in Alzheimer's disease may cause difficulty finding recent conversations, events, or familiar places. Misplacing things and the inability to retrieve them make daily tasks more troublesome. Loss of initiation and poor judgment are also observed. Dementia may also be associated with mood and behavioral changes. If it is untreated, it can slowly progress, resulting in difficulty with language, social withdrawal, poor thinking, and confusion. Alzheimer's disease is produced by the slow degeneration of a few of the neurons in your brain, which impairs memory as your age progresses. Deposition of a few proteins, like amyloid beta protein, causes this degeneration of neurons in your brain. Neurons supplying acetylcholine to the cortex and hippocampus are mainly affected, which impairs memory and learning. Donepezil increases the transmission of acetylcholine, thereby improving the symptoms of Alzheimer's disease and the quality of life. So, in this video, let's explore Donepezil, how to use this medication, how it improves memory, and what the possible side effects are. We will also discuss important precautions that should be considered while using this medication. Please don't forget to subscribe to this channel, and please click the bell icon to get more updates from this channel. If you really enjoy watching this video, don't forget to hit the like button and share it with your friends. Now, let's see how to use this medication. Donepezil is available as a normal tablet as well as an orally disintegrating tablet. You should handle it with dry hands, as any wet conditions can promote the immediate disintegration of the tablet. It is also available as a combination with another medication, Memantine, and this combination can be used to treat moderate to severe forms of Alzheimer's disease. Donepezil should be taken in the evening at bedtime. This reduces the risk of dizziness produced by this drug. Rarely, in a few conditions, when it disturbs sleep and causes illogical dreams, it may be given in the morning. It can be taken either with or without food. It can be taken by mouth, where it is dissolved on the tongue, followed by a glass of water. The dose of Donepezil depends on the severity of Alzheimer's disease, and your physician will decide the initial dose after assessing the severity. As Donepezil acts centrally and works on sensitive processes, it is always initiated at the lowest dose possible to avoid any significant side effects. For the treatment of mild to moderate Alzheimer's disease, an initial dose of 5 mg of Donepezil is prescribed. Based on the requirements, the dose may be increased to 10 mg per day after 4 to 6 weeks of treatment. In severe cases of Alzheimer's disease, the dose may be increased to 23 mg given at bedtime. Such a high dose of Donepezil is given only after treatment with 10 mg for a period of at least 3 months. Now, let's see how Donepezil works in dementia. Memory is an essential function of the brain, and at the hippocampus, acetylcholine plays an important role in maintaining memory. Cholinergic neurons are densely located at the hippocampus, and the loss of these cholinergic neurons results in age-related dementia. In a few people, loss of cholinergic transmission is often associated with inflammation of cholinergic neurons, which causes loss of memory and the onset of Alzheimer's disease. Neurons form a junction called a synapse, and acetylcholine plays an important role in neuronal transmission. Donepezil mainly works by improving acetylcholine levels at the synapse, which improves signaling between neurons. Normally, neurons implicated in memory store acetylcholine and presynaptic neurons. On the postsynaptic neurons, acetylcholine receptors are expressed, either muscarinic or nicotinic. When presynaptic neurons are excited, they release acetylcholine, which acts on postsynaptic receptors. The released acetylcholine can activate either nicotinic receptors or muscarinic receptors, resulting in stimulation of postsynaptic neurons. In Alzheimer's disease, this cholinergic transmission is reduced due to the loss of a few of the cholinergic neurons. Even though this situation can't be restored, neuronal transmission can still be improved in another way. The action of released acetylcholine is limited by its hydrolysis at the synapse. In this space, one of the enzymes, acetylcholinesterase, is present, which specifically cleaves acetylcholine. Through the action of this enzyme, acetylcholine can be hydrolyzed into two fragments. One is choline, and another is acetate. Donepezil reversibly blocks this enzyme at the synapse, which results in an increase in cholinergic transmission and an improvement in memory function. This relieves the symptoms of Alzheimer's disease, facilitating daily activities. Now, let's discuss what the side effects of donepezil are. At low doses, donepezil is well tolerated, and it shows mild side effects. Initially, you can observe gastrointestinal side effects. It can cause diarrhea and nausea initially. It can also produce difficulty sleeping and induce drowsiness and dizziness. For this reason, it is recommended that it be taken at bedtime to minimize any drowsiness. It can also produce tiredness. Occasionally, it can cause tremors and muscle cramps. These side effects can slowly disappear after a few weeks of treatment. Now, let's focus on the precautions that to be considered while taking donepezil. As donepezil increases cholinergic transmission, it can increase vagal effects on the heart, resulting in a slowing of the heart rate. So for people with pre-existing cardiac disease, this drug should be carefully used. Donepezil can also prolong the QT interval in the ECG, which is associated with fatal cardiac arrhythmias. This can be further increased by coexisting conditions and concomitant medication. Care should be taken when you are taking diuretics or potassium-depleting medication along with donepezil. You can observe nausea, vomiting, and diarrhea with donepezil, particularly at a dose of 10 mg and a further higher dose of 23 mg. That's why the dose of donepezil shouldn't be suddenly increased. Another effect of increased cholinergic transmission can be observed in enhanced gastric acid release. Therefore, chronic use of donepezil can increase the risk of gastric ulceration and bleeding, particularly in people with any previous history of gastric ulcers. A similar effect of increased acetylcholine levels in our body can produce bronchospasm. This is especially important for people with asthma or chronic obstructive pulmonary disorder. Intake of alcohol can increase a state of confusion and dementia, so when it is combined with donepezil, the efficacy of this medication may be reduced. Even this combination increases dizziness and drowsiness. Therefore, it is recommended to avoid, or at least limit alcohol intake while taking donepezil. You can also observe a significant weight loss with the use of donepezil, as this medication reduces appetite. Due to its enhanced effects on cholinergic transmission, donepezil should be carefully used in people with any history of seizures, gastric ulcers, asthma, or respiratory disorders. Finally, let's see the chemical form of this medication. Donepezil is a piperidine derivative that is attached to a benzyl group at nitrogen. Few people are allergic to piperidine groups of compounds, so if you observe any serious allergic reactions with the use of donepezil, you should discontinue and consult with your physician. Piperidine ring is further attached to another heterocyclic ring, dihydroidine, in the fourth position. So that's all about the pharmacology of donepezil. Thanks for watching this video. Please don't forget to subscribe and hit the like button. Stay tuned for another interesting video with a new topic. Until then, have a nice time, take care, and goodbye.